The autopsy report on actor Heath Ledger is drawing more attention to a campaign called Zero Unintentional Deaths. Utah physician Dr. Lynn Webster is the driving force behind that project.
He says Ledger's death is but an example of what some call an epidemic. Ed Yates reports.
Unfortunately, what's happened to Heath is becoming increasingly more common. It is, I believe it's become a crisis.
Dr. Lynn Webster speaks of unintentional death, taking a combination of prescription drugs which by themselves and in the right dose may help, but when used in combination with other medications can kill. Heath Ledger's recipe was a bad one. The interaction between these already potent drugs produced acute intoxication.
Pain relievers like opioids and anxiolytics like Valium, as well as sleep aids. You add all of this together, for somebody who is otherwise healthy, it can be lethal.
The advice really hasn't changed. Patients combining prescription drugs to treat different ailments should always talk to their doctor or a pharmacist about possible interactions.
People think often that it's just like taking another ibuprofen or aspirin.
Zero Unintentional Deaths is designed to educate physicians, patients, and families about potential risk when you try to mix and match.
Unless you know that, or know whether or not that drug can have an additive or synergistic, which means 1 + 1 can equal 5, that's what I mean by synergistic effect, then you're really self-medicating yourself and assuming a great deal of risk.
Some drugs can backfire. For example, taking extra sleeping pills or combining them with an antihistamine might trigger a different kind of fatigue that actually prevents restorative sleep. It's unfortunate, Dr. Webster says, that it takes the death of a prominent actor like Ledger to focus the spotlight on something that affects all of us. Ed Yates, Eyewitness News.
For more information on Zero Unintentional Deaths, visit our website at KSL.com.